Just dim the lights. Yeah, perfect. Okay. Good. Good morning. Good morning. Okay. All right. My name is Darshan Mehta. I'm Associate Director of Education for the Osher Center for Integrative Medicine here at Brigham and Women's Hospital. Welcome to our Integrative Medicine Grand Rounds. And before I introduce our presenters, just wanted to highlight a few upcoming events that we have and hope that all of you and those that your colleagues that were not able to come this morning will join us. First is this Thursday, April 7th, from 4 to 5 p.m. here at the Brigham in the Shapiro breakout room. Dr. James Stahl, who is the Section Chief of General Internal Medicine at Dartmouth Hitchcock Medical Center, will be coming here to present on a seminal paper published recently entitled Mind-Body Medicine, the Effects of Stress and Mind-Body Medicine on Healthcare Utilization. So please do join us. In addition, we just wanted to give a preview for our Integrative Medicine Network Forum, which is now been scheduled officially for November 18th. This is, as many of you may remember, we had a Integrative Medicine Network Forum 2 years ago, and so we are looking to build upon that momentum and as well as these gatherings, and more to come there. The flyer is out in the front, so please pick one up. And again, please do let your colleagues and others know. Also, we have our next Grand Rounds, which is on Tuesday, May 3rd. It's a Calmare Therapy and Innovative Pain Treatment. What is it? And Dr. Ezra Cohen, who is a pediatric rheumatology fellow here at Boston Children's Hospital, will be presenting on that case as well. So, without further ado, I'd like to introduce our presenters from Boston Children's Hospital, and the clinical case presentation is Family-Centered Integrative Care in a Pediatric Hospital, Interdisciplinary Model. Their bios, which are extensive, are on the handout, so please read them. But in the interest of time, I will invite Dr. Emily Davidson to begin and present her presenters as well.
Thank you. It's a great pleasure to be here today and share some of our work with you. In the interest of being in this place at this time, take a big breath in and out. Slides are working and the show can go on. We have no financial interest to disclose related to this presentation. The David S. Weiner Award helped to support some of the yoga that I've been doing at Children's Hospital. So our objectives for today were to understand the impact of caregiving on physical and mental health for families, understand factors contributing to the state of well-being in pediatric patients, understand the role of integrative therapies and symptom management in the context of family-centered care, and increase awareness of some of the integrative health services available at Boston Children's Hospital for patients, family, and staff. So just as an overview, I'm going to present a little bit about context, a little bit about why are we thinking about this in a family-centered way and having an interdisciplinary team working on these issues together. We'll talk a little bit about the impact of caregiving on caregivers, and then talk about some of the integrative therapies that we're doing, and I'll leave that for our discussion. Our ambitious vision is to be the world leader in setting the standard for supporting the wellness of the entire family. So we're thinking children, family, and our extended community. And so for context, I'm going to invite Ann Berry. We're very lucky to have one of our Children's Hospital patients, who's actually one of our adult patients, here with us today. And she's just going to give us a little teaser blurb about what brought her to integrative care services at Children's.
I'm Ann Berry. In 1998, I was diagnosed with HSP, and I first was treated by and met Dr. Lin then, and sort of stopped seeing him. And then when I was diagnosed with epilepsy a few years ago, it was sort of difficult to treat. My mother said, "You have to start going to see Dr. Lin again. I've been really thinking about it, and you absolutely should." And he has been helpful to me ever since, as has been complimentary medicine.
We'll get more into that soon. I'm going to give us a little bit on a little 8-year-old girl admitted for Hale brace traction for 4 weeks prior to spinal surgery. Then Dianne Cella, who's working in the Center for Families, will talk about a mother who she's been seeing who has had congenital diaphragmatic hernia and was hospitalized for 7 months in the ICU on ECMO. Lori Lazdowsky, who is a nurse working in the pain treatment program, is going to talk about a 3-year-old girl with a Dandy Walker assist and QRE1 malformation who had a posterior fossa decompression surgery and continued to have chronic headaches from age 2 on. And then Stephanie Porter, who is a nurse working in our community, is going to talk about one of the common presentations we see in the community, which is a 10-year-old boy coming to school nurse complaining of a bellyache on the day of his class, that his class is scheduled for MCAS testing. So what we wanted to sort of bring to your mind is just when we're talking about kids, we're talking about a lot of different things. We're talking about different contexts and different people. And one of the big areas of interest for me is how that, what's the impact of caregiving on caregivers? Because when we are working with kids, we're working with the kids, but their families play a huge role as well. So there's some interesting research that's been done on the impact of caregiving on caregivers. There are impacts on physical health. So nearly twice as many family caregivers report fair or poor health status, had a chronic condition or disability compared with the general population of working age adults. Family caregivers, you would expect some of the things like maybe low back pain, maybe some mental health things seem like you would expect those, but I wouldn't have expected. They also have twice the rate of serious illnesses like diabetes, heart disease, cancer, and arthritis. And so why might that be? Maybe it's some of these things they've seen in family caregivers: increased stress hormones, decreased immune responses, contributing to chronic disease. Mental health issues are more prevalent in people who are caregivers. 40 to 70% of family caregivers report clinically significant symptoms of depression, increased stress levels, exhaustion. And then for us as providers, we have to also think about the cognitive impact, because it can impact short-term memory, attention, and verbal IQ, which can play a role when you're trying to explain what's going on with a family member. As we all know here, use of integrative therapies is huge in this country, $14.9 billion out of pocket to treat different issues, particularly pain. It's also big in kids. So you see the 10 most common complementary and alternative therapies used by children: natural products, chiropractic and osteopathic, deep breathing, yoga. These are being used by substantial numbers of kids. What are parents using it for? Back or neck pain, head or chest cold, the things we have trouble treating with our traditional medicines, our Western medicines. Also musculoskeletal conditions, anxiety, stress, and ADHD. So just briefly, I'm very interested in using yoga with kids, and I worked with a little girl who I had met when I was doing an inpatient yoga class for children and families. She returned to the hospital. She has neurofibromatosis and had very severe scoliosis that was impacting her respiratory function. So she was going to undergo a spinal fusion, but her spine was so bent that she needed to undergo halo traction in the hospital for 4 weeks to straighten up enough to be able to do the surgery. So this is a different patient in the hospital who is demonstrating the use of that device. So they can move, but they're in a wheelchair with the traction on the head. So with my patient, she also had selective mutism, so she wouldn't talk to anybody in the hospital, although she talked to her parents. She would communicate with us with smiles, yes and no, and so you could find out what she wanted to do and what she was comfortable with, but she wasn't talking. So we did seated yoga, we did some meditation, and a little bit of aromatherapy. And are you having trouble hearing? Is that better? Oh, there we go. Okay. So by doing yoga, she was able to actually experience being in her body in a more positive way, being able to move, even though she was stuck in her chair during the day. There's not too much written yet on yoga in the hospital for kids. There are a few feasibility studies. There's a small pilot study evaluating feasibility of doing individualized yoga for inpatient children that was recently published. They showed some reduced anxiety and agitation, better sleep, and improved mood. And then one of the things that for me feels the most important is many children felt that yoga had given them the opportunity to relax and, quote, escape from the hectic hospital environment. So part of me, I think there's a huge need, and the meta-analyses of yoga for children are all sort of like, well, there aren't that many great quality studies. The studies are all different. There seem to be some positive effects. So I think there's a lot of need for research in this area, but also for me, the bottom line is too, if we can make kids feel better, I don't know if we necessarily have to have research evidence to say it's still a good idea to do. If the kids feel like they're requesting it, they want it, and they feel better when they have it. So some of the things that are promising in the adult literature that make me want to do this more with kids, that meditation can decrease physiologic responses to stress, such as cortisol, cognitive impact, memory effects of stress. For caregivers, they've seen meditation improving depression and burden in family caregivers of patients with dementia, which is a very high demand patient population for their caregivers. Yoga has also been shown to decrease depression and anxiety and improve quality of life for families of neurologic inpatients. And then there was a really neat study where what struck me about this one was how brief the intervention had to be. 12 minutes daily for 8 weeks of a yogic meditation actually reversed the NF-kappa B and IRF-related transcriptome dynamics and leukocytes, so improve the immune status of these families of dementia caregivers. Another study with increased GABA after 12 weeks of 3 times a week yoga intervention. So there's some really promising stuff. Just briefly what we're doing in the inpatient, we have a few people doing Reiki, aromatherapy, urban Zen integrative therapy, which Dianne will talk more about, yoga, massage, acupuncture. We also have child life, therapy dogs, music therapy, art therapy, and the chaplaincy all play a role in kind of holistic health for children in the hospital. For yoga programs, I teach a class at the Martha Elliott Health Center, which is an outpatient inclusive yoga class for kids. So some of the kids have Down syndrome, cerebral palsy, attentional issues, and others are typically developing peers. And then we have, I do a class for parents and community, including staff. And Dianne teaches in the Center for Families, and then there's another staff mat class. So we have a number of things going on. And here I'm going to turn over to Dianne Cella from the Center for Families.
So here is a, can you hear me okay? Here's a picture of the Hale Family Center for Families, and it is to support families of patients and their families at Children's Hospital. Within the Hale Family Center for Families, it's quite a mouthful, I know, is a wellness program. The Hale family opened up about 14 months ago. I got a call because I've always been interested in integrative therapies, asking if I was interested in starting a wellness program. So that was the day my dream came true. And since then, over the last 13 months, we started a program where we offer meditation along with the chaplaincy program, Reiki, yoga, and massage, and Zumba for those who want to do something a little less serious. But of course, the whole premise embraces the concept of patient-family-centered care, providing care to the caregivers, and we've to date have given more than 800 treatments of both massage and Reiki since it started. We also have done evaluations. They are anonymous, make sure they're anonymous, but of stress levels before and after treatment. And I have to say that 100% have said that they've had some reduction in stress, which you can't really say that too often about anything. But we have a beautiful room, and I'll be going into that. You'll see it. But to talk about what happens in our wellness room, I thought I would just do a case study, and hopefully that will just do a better illustration of what happens. So as Emily has mentioned, my case study is that of a mother who's 38 years old who's struggling with anxiety, exhaustion, and overall stress after having a full-term infant born with congenital diaphragmatic hernia, status post-repair on ECMO. The congenital diaphragmatic hernia was diagnosed in utero, resulted in immature lungs, cardiac involvement due to pulmonary hypertension, a subsequent tracheostomy, and currently the baby is on a ventilator and G-tube dependent. So I'm going to just go to this next one. This is not the mother, but this is a mother. I'm trying to be respectful of her privacy. But basically, the parent, the caregiver, will come into this beautiful little room. It's not very large, but there's music. There are, you can see candles, they're fake, and the use of essential oils. So for half an hour, people, they can sign up and they'll have a treatment. So, you know, this person is in a reclined cobbler pose. It tends to be the position that the patient is in, but they can be on their side, they can be on their stomach, that's okay. I'll offer them essential oils. This mother happened to like sacred frankincense, which was really good for anxiety, and valor for exhaustion. And another mother turned me on to a essential oil called Stress Away, and it smells really good, and a lot of mothers like it. I should do a study on it. And I'll just infuse a cotton ball, put it on their chest, darken the room, the candles are on, and I begin with just starting with some suggestions such as closing their eyes, some breath awareness, observing breath with, you know, just a rate and rhythm without changing anything, noticing the coolness of the breath and the warmth of the breath, followed by a progressive body scan starting from the feet, just kind of grounding. Sometimes I'll actually wrap their feet with a blanket. Sometimes the use of guided imagery. This particular mother loved going to the ocean, so that always made it fun for me too, because you really have to focus on what they may be focusing on. Reiki, and usually the treatment's a half an hour. Sometimes it will go a little bit longer, depending on my schedule. So the mom, after the treatment, mom consistently stated that she felt less stressed, lighter, often cried, and sometimes laughed. And in that room, a lot of times parents will cry because I think they just finally get to let down. And the baby finally got to go home after 7 months, but unfortunately then had a cardiac arrest and sustained a hypoxic brain injury, resulting in severe damage to her brain stem, which was heartbreaking because she finally got her home. And doctors informed mother that the baby would never walk, see, or talk. She was faced with some decisions. Mother decided to do what she liked to. Mother decided what she would like to do was to take the baby home. So the baby remains on a respirator, requiring tremendous amounts of skilled nursing care. And mom says, because I just saw her the other day, said that the baby has started smiling and occasionally starting to turn over and can hold up her head. The reason why, one of the reasons I chose this case is because it's not over when they leave the hospital. You know, they still continue with stress at home and needing a lot of health care at home. So I like to think that the Wellness Center provides a port in the storm, and mom says it was her saving grace. So, and she knows that when she comes back, she just has to ask for treatment. Many of the modalities that we use, I've learned through a program called Urban Zen Integrative Therapies that Emily, Laurie, and I got to go to. And they use restorative yoga, which is lovely, to just be put into a restorative yoga position, essential oils, Reiki, and body scan. And they target specific symptoms of pain. It has an acronym, PANIC. That's how I always have to remember, but it's pain, anxiety, nausea, insomnia, constipation. And they added exhaustion and sadness. And I have to be honest with you, I think mostly it's exhaustion and sadness that I treat. This is just a quick example of what we offer right now, which is meditation, yoga, Zumba, Reiki, and massage. And both Reiki and massage need appointments. Otherwise, they can join us. This is the chapel. We have one of our chaplains here today, and it's a beautiful screen, and just that's me doing yoga with some nurses, actually. And then we'll offer yoga twice a week. This is a chair yoga, but we also have mats and blocks and that kind of thing. And here's Zumba. And that's a great one. And people just really like that because it's just fun. So we've done 352 Reiki treatments, 530 massages, 48 yoga classes, over 30 Zumba classes. We do meditation in conjunction with chaplaincy, and aromatherapy is used. Here's just an example of how the pre and post on Reiki and massage on stress. And just I'll just they do a survey, as I said, before and after, and many people will write in. These are just a couple of a few of the comments. Absolutely beneficial. I almost left in tears of relief. I can breathe again. Providing more information about this type of program would help parents. Thank you. We were really fortunate. Yoga Reaches Out, an organization, has just awarded us a major grant, so we'll be able to expand the program to 7 days a week. We're very excited about that. Thank you for allowing me the opportunity. I think it's time. There's nursing credentialing competency guidelines, and I love this quote, because you never know which way your path is going to go, and this is Joseph Campbell, one of my favorites. We must be willing to let go of the life we have planned so as to have the life that is waiting for us. Thank you. This is my friend Laurie Lazdowsky and colleague.
Thank you. All right, so I guess that lightened up the room a little bit. So good morning, everyone. This is a slide that a good friend of mine sent, and I'm always trying to explain Reiki. And I thought this was kind of cute. So this is not what we do at all. All right, so I will give you a little definition. So Reiki, many of you know what it is. It's very old Buddhist tradition that actually was a little bit lost and then refound in Japan in the 1800s, and then actually came back to the United States, to Hawaii, and now many of us are practicing, and we have the benefit to offer this to patients. So as we know, it's this Japanese healing practice, and it's basically a positive life force energy. And the two pieces of it are Rei and Ki, and Rei meaning the universal power, and Ki meaning life force energy. Okay, so here is a patient of ours in clinic receiving Reiki. And it's a wonderful offering. We, are looking for the relaxation response, and many people do experience that and are reporting it. So, some of the literature, which it's pretty slim, it does talk about, effects on the immune system and how it does increase the white blood cell count and, in fact, make people feel a little less stressed and a little more positive. It is helpful for sleep. It can lower the vital signs, the heart rate and breathing rate, and just bring general calming to a patient. It's a wonderful modality. So just to talk a little bit about what we do at Children's, I work in the chronic pain clinic, in particular now with kids with headache in the pediatric headache program. And chronic pain, as we know, is any pain that is longer than 3 months existing. And what we typically see in pediatrics are chronic daily headache, abdominal pain, neuropathic pain is, quite often seen, as well as musculoskeletal pain. And kids that come to us are, kind of exhausted their road for medical modalities. And, many kids are, multimodal, they've looked into surgeries and multiple medications, and, they're looking for that something extra. And integrative therapies are valuable for patients as well as families, because we can offer these things that don't have side effects and, can really, impact calming and relief and stress relief. So some things we do in clinic here are Reiki, guided imagery, urban Zen, integrative therapy, which you heard a little bit from Dianne about what that is. It's a wonderful modality with yoga, integrative therapies, as well as essential oils. It's a nice thing for kids to really have an option to learn about and try. So we also have something called the biomat in the headache clinic that we offer kids, and I do have a slide later on that will describe it. But we do see over 2,000 patients a year and have the luck to offer these modalities to them as well. So here's the biomat that I talked about. It's something that we learned about actually through one of our nurse integrative colleagues. And it's a combination of infrared light technology with amethyst crystal channels, and it really produces a very wonderful warmth and soothing feeling. People say that it reduces stress, fatigue, and it's actually Korean technology, and a lot of people use it for inflammation states, cancer, muscular relaxation, and it does, help with sleep as well. Okay, so here is our case study, and we're calling this young girl Grace, and she, as Emily mentioned in the beginning, has a history of Dandy Walker, Arnold-Chiari malformation, status post-posterior fossa decompression, actually at the age of 3. And now she comes to us from actually far away across the country, from Midwest, with chronic pain that multiple medical providers have not been able to really help this family with. So, we're, offering our typical modalities, medications, therapy, relaxation, but the mother's asking for something more. She's looking for something alternative. So we do offer, some urban Zen, some Reiki. It was a wonderful treatment, actually, the first time I met this child, who was, cognitively a little delayed. But the mother was very positive about this modality, and we, had the great fortune of finding a wonderful space to offer a little bit of restorative yoga. We did some stretching in the beginning. She didn't like our weird music. She was like, can we put something else on? So we chose some Disney princess music that really got her, in a good spot. And, she enjoyed some lemon for essential oils. And I got her to really, really calm down. I'm not sure if this child, who's had multiple interventions, really gets in that place quite often. So I think the family recognized it and the child did, and she actually wanted to come back, which was, amazing, positive result. So just to flip over a little, something that we're doing, some of the nurses at Children's do go to the Bling Camp. I don't know if people have heard about this, but this is the myelodysplasia program at Children's. They offer this wonderful retreat yearly for these kids with myelodysplasia, spina bifida, and many of them are wheelchair bound or they have braces. And you can see one of our nurses, Regina Sullivan, who is going around in a circle. But they ask for it every year. They get wonderful things like their nails done and makeup, but they always have to have the Reiki there too as well. So this is something wonderful we can offer. Just to tell you a little bit about some of the nurses at Children's, many of them are involved in the American Holistic Nurses Association. We do meet monthly in Westwood, and there's the website there if anybody is interested and would like to check it out. It's an open meeting, but basically it kind of brings together the whole family-centered care topic here. We're caring for ourselves and caring for others, and coming to a place of kind of like minds are meeting and sharing these wonderful healing practices. We do have education and sharing and community. We have many school nurses that come to us that we can talk about these, great offerings, and people are really sharing, and it's an amazing group. So just a little bit about the Nurses Association. Here is the mission. I won't get into that, but we all know what that is. And it is associated with the Certification Corporation, so we do have many nurses at Children's that are certified in holistic care, and that is available. So just to kind of wrap up a bit here, creating a healing culture for ourselves and our patients and families is the focus of what we do at Children's. 85% of medical problems can be self-limiting or chronic. The curing and elimination of signs and symptoms of disease in diagnosis is not always possible, but healing is always possible. So just to let you take a look at this, self-care and caregiving. This is a wonderful saying by Thich Nhat Hanh. Love is the capacity to take care, to protect, and nourish. If you're not capable of generating that kind of energy towards yourself, then you are not capable of taking care of others. So this is wonderful and something to just ponder on. And I'd like to introduce Stephanie Porter, who is our community health program nurse, so she will give you the exact title, but she works with all our school nurses and brings wonderful education to the community. So here is Stephanie.
Thank you, Lori. So thinking about what happens out in the community as kids transition from hospital to home to school, as Dianne was talking about that little girl, I was thinking about this slide in terms of the Department of Public Health Pediatric Palliative Care Network that offers programs to improve the quality of life for children with chronic illnesses. And this is a very important program that really its goal is to enhance the quality of life for children. They offer music therapy, pet therapy, massage, Reiki, yoga, and art. And if you don't know about it, there's a whole DPH website that does talk about it. So where do kids spend most of their time? Children and youth spend about 180 days. They spend 180 days in school, maybe not yesterday when it was a snow day. Approximately 1,080 hours, which is about 6 hours a day. But that does not include after-school sports clubs or after-school activities. So the stressors in the school are many, from academic to social. Personal and family issues overflow into the school setting. In any given day, the school nurse's office will have children who have physical concerns, including the top two, headache and belly aches. The nurses will also see children and teens who come in with a range of anxiety, school phobias, and lately a host of self-injurious behaviors like cutting. There are many children who are in the school with chronic health conditions, such as seizures, diabetes, genetic disorders, and other conditions. And more children are attending school with gastrostomy tubes, tracheostomies, and ventilators. So Boston Children's Hospital Community Education Initiative is a program that provides a number of educational programming for school nurses. We provide about over 70 programs a year. We train over 2,500 school nurses in a given year. And a number of topics. So we provide clinical topics, we provide topics in mental health, and we have a wellness strand. And within that wellness strand, we have programs such as calming and coping strategies, mindfulness, positive affirmations, Reiki, acupressure. We like the school nurse's office to be calm and an area where kids can go to feel good, so we do a little feng shui. And we've also done some aromatherapy. We hope these programs really enhance the school nurses' practice by offering them a number of different modalities to use as the kids come to their program. So we're consistently getting feedback about what school nurses are doing in their practices. So for the 10-year-old student that Emily mentioned at the beginning who comes in prior to MCAS training, MCAS testing, which as we all know is one of the most anxiety-producing tests for kids and schools and parents, the school nurse would see this child who might present with a bellyache. So the school nurse would provide maybe some slow, deep breathing with the child, asking them to take some good deep belly breaths, putting a little toy or anything on the child's belly, perhaps adding some Reiki to that abdomen, and then maybe doing some visualization with the child's favorite place. Return to class is such an important thing for schools. This is what all schools are talking about. We've got to get those kids back to class. So the nurses have been worried about how much time the kids spend in the school nurse's office. But what they are telling me is that a small amount of mind, body, spirit moment can make a difference, and the kids don't return as often by giving them those little snippets of time. We want to teach the nurses how to do their own relaxation techniques. As Laurie was saying, we need to take care of ourselves first before we can take care of others. I don't know, but that cat looks pretty comfy to me. In Wellesley, the school nurses this week are providing a class for 8th graders on calming and coping strategies, modeling after a community education class they attended. And they're including breathing, relaxation, and visualization. And one of the visualizations we do in the calming and coping is a white waterfall. And the school nurses are bringing that to their 8th grade students. Recently, a school nurse sent along a letter, and I quote, "I was inspired by the class on calming and coping strategies. I was able to transform my office to a tranquil, comfortable, relaxing, refreshing space. Initially, it was white, no privacy, brash, harsh posters, anatomical, drug-type posters along the wall. I painted it a calming green, read a feng shui book, changed the placement of the beds, added a privacy screen, added a water fountain, a fish tank, plants, a wooden desk, and artwork. I was able to get the paint costs reimbursed from the local Lions Club, and the Leo Club students helped paint the office. The fish tank was donated. The result, positive feedback from students, staff, and parents." School nurses are bringing positive affirmation into their offices by doing a couple of different things. They're creating bulletin boards where kids can add positive thoughts about themselves. I love to read some of these. One wrote, the very top one, I am good at writing, Daniel. And the bottom one is, I funny boy. So kids are talking about how good they feel about themselves. School nurses are often also providing small baskets of positive affirmations where you can pull out a positive affirmation for the day. You might want to try that yourself. You might want to create your own positive affirmation for yourself. I do it in my office at work. People always kind of come in my office and go, But pulling a card or pulling an affirmation can set the tone for your day. My slide went behind the slide. Some nurses provide children with a variety of colorful stones with sayings on them. The children can use their stones to refocus their attention and decrease some of their worries and concerns. One school nurse mentioned how a child came in and asked for her favorite stone during a time when the child was feeling a bit anxious. Recently, I attend a lot of IEP meetings in my other job. And while visiting a school at an early morning meeting, we stood for the Pledge of Allegiance and followed that. The principal asked us all to join her in a tree pose. Oh, I think that's just wonderful. So just in closing my portion, the school nurse is in an excellent position to bridge the world of mind, body, and spirit. Darcy Keegan and Gozzetti state, by seeing the connection between physical and mental symptoms and the environment, the school nurse brings holism to school nursing practice. Thank you. And I'd like to present Dr. Lin.
I am Yuan-Chi Lin. I work at Boston Children's Hospital. And I grew up in Taiwan, and my father was an obstetric gynecologist. I wanted to take care of babies, so I became a pediatrician, and I interested in intensive care, so I got into anesthesia. And then I came here for pediatric anesthesia fellowship, and after doing anesthesia, I interested in pain management, so I went to Stanford, did the training in pain medicine. And then not until I become a pain doctor, I started to do acupuncture. I think acupuncture has a unique characteristic and to bring in as part of a pain management scheme. We did a study looking into pediatric pain center and asking them what kind of the complementary alternative medicine provide in the pain center in North America. And this is now open the yellow page. This is provide inside the institution. More than 1/3 of the pediatric pain center in North America actually offer acupuncture. We did another study looking into kids coming to Boston Children's Hospital for surgery. We asked them 1 year prior to the surgery, have you tried various different kind of complementary alternative medicine or not? And 6% of kids coming to Boston Children's Hospital for surgery actually has tried acupuncture. And acupuncture, most of people understand is stimulate through the needle. And there's a moxibustion. You can heat it up, warm up, facilitate the energy flow using moxibustion. And also using electrical stimulation on the acupuncture point can be applied. And cupping is not uncommon things we do, especially for pediatric population. And you can, Stephanie also mentioned earlier, talk about using finger pressure, acupressure. And Professor Hunt and from Beijing University actually has done extensive study looking into low frequency versus high frequency electrical stimulation, which mediate through endomorphin and caffeine beta endorphin through low frequency electrical stimulation, and then mediate through different opiate receptor and produce analgesic effect. And we actually have done acupuncture research here at Brigham and with Dr. Gerner, and we used the Chang model and create a nerve injury in the rat, and which is shown electroacupuncture can change the withdrawal thresholds. Acupuncture, most of people understand, can easily apply for pain management. And over the past 3 years, we have about 260 new patients. Most of our patients are female, and we got referred from various different specialties. And believe it or not, at the Boston Children's Hospital, we have on-call schedule for acupuncture. The clinician actually call us for consultation. We see inpatient for consultation with our outpatient clinic located in Waltham. And we are very patient-focused, family-oriented, integrated care. And we don't see adult, but we do see kids' parents or grandparents. Sometimes they bring their kids come to our clinic. We have extra arrangement for them. Most of the kids will say, yeah, needle, I don't like needle. But after you do acupuncture, you feel like this like small toothpick rather than needles. And we also did a study looking into in pediatric patients undergoing ear tube surgery, and we randomized to acupuncture versus no acupuncture. The acupuncture group and has less pain after the surgery, and the acupuncture group actually has less agitation after the ear tube surgery. And in my hand here, this is a acupuncture point finder. Acupuncture point increase electroconductance, decrease resistance. So you can use these to find the acupuncture point. And for kids, we do various different modalities. And this is a device you can do the acupressure on without, there's no needle. Or a lot of kids come by, we ask them to do acupressure. We give them schedule, going to school on school bus, coming back from school on school bus. They do acupressure to help prevent headache. And this is the patient with mitochondrial disorder. We do acupuncture. Look at that, my needle actually in her doll. Mom was in the background blowing the bubbles and come back. And we use acupuncture to treat nausea, vomiting, to prevent nausea, vomiting for this patient. Look at the baby fighting with ventilator. There's a little tube, acupuncture in the ear, help the baby for sedation. The patient in the recovery room couldn't go home because of nausea, vomiting, and we did acupuncture, and she sent a note back to me, says, thank you so much for giving me acupuncture. You helped me a lot, like the magic trick. You got me out of the hospital so I could go home. It's very important we listen to the patient and get their feedback. Another patient we had before with complex regional pain syndrome in the foot, we use different modalities, integrative medicine to help her. She sent a note back to us, said, you're not like those doctors. You listen to me. You believe in me when I said my foot hurt. You make me happy again. I can run and jump without pain. And it's very important to differentiate the difference between disease versus illnesses. Disease is what we diagnose the patient has. Illness is what the patient feel, what the patient suffer. Patient, for example, patient with cystic fibrosis, that's what we diagnose patient has. That's a disease. Patient with cystic fibrosis would have a lot of different associated illnesses. Headache, chest pain, pleurisy, abdominal pain, joint stiffness, a lot of insomnia, anxiety. Those illnesses, you can easily integrate acupuncture as therapy modalities. In Boston Children's Hospital, we have a lot of people interested in integrative medicine, and we're all working together for the common goal to help the patient and family. I'm going to invite Ann Berry come by to talk about her experience about acupuncture and the integrated medicine.
Hello, I'm Ann Berry. In 1998, I was diagnosed with a severe autoimmune disorder. This disease resulted in kidney failure and leading ultimately to a kidney transplant in 2013, as well as a seizure disorder. Acupuncture has helped with both of these issues, as well as many other things. Despite the kidney failure, I was able to continue working as a nurse right up until the transplant. I believe this to be highly related to the restorative effects that acupuncture, cupping, and moxa had on my body and continues to have. My blood pressure and electrolytes were stable with only necessary medications, and I remained active throughout the entire time of my inclining creatinine. Acupuncture helped me stay as healthy as possible throughout the transplant process and led to a fast recovery. I even had acupuncture the night before surgery, helping me to go to bed as calmly as possible. I also know that my seizures are related to stress and fatigue. Pre-transplant acupuncture helped to decrease the fatigue, in turn decreasing the seizure activity. Going to see Dr. Lin now gives me the monthly stress relieving effects that my body needs. I leave each appointment in a completely relaxed space and get my best sleep the night after each treatment. Missing a month of acupuncture, an appointment in a month, it leaves me feeling noticeably more stressed and with greater difficulty sleeping, often resulting in an increase of seizures and extra medication. Although total control of my epilepsy is still a work in progress, the addition of acupuncture to the anticonvulsant medication keeps me not only in a safe space, but also able to attend graduate school and continue to work at the job that I love.
I think we're going to take some questions. Yeah.
So when you can sit up front and you can actually pull up the numbers here. So we had a little bit of technical difficulty just getting the present, so I understand we were right up very close on, so we'll have time for about 2 questions. But as the people are getting set up, and then I want to encourage all of you to please join us in the coffee hour right afterwards, just across the hall, where you can continue this dialogue. But first, I just want to thank our wonderful presenters, and thank you for just an amazing program. So please, a round of applause for our presenters. Questions from the audience? Right here. Yeah.
Thank you very much. Emily, when you said early on that that caregivers compared to other age-related, comparable adults have higher levels of real disease as well as stress, does that mean, what is a caregiver? Is that any parent, or is that a parent of a child with, or a person with some illness?
In some of those studies, I think it's self-defined caregivers. A lot of those were done with adults caring for elderly. The population of parents caring for children, with children with significant needs, is much smaller. So I wouldn't say a general any parent might have a little higher stress, but I think it's the parents of kids who have more complex needs, and then the adults who are caring for elderly or other relatives with significant needs.
Excellent presentation. I feel uplifted. I was particularly interested in this urban Zen integrative and the mission of it, which is to bring alternative therapies into mainstream. So is somebody who can speak a little more on that?
Sure. So it's a really interesting program, and just to give everybody a background on it, Donna Karen is the mastermind behind it, the clothing designer, and her husband went through. He died of cancer, and when he was she had used a lot of complementary therapies herself throughout her life. He had always sort of looked askance a little bit at it, but then started to use them when he was sick and found them really helpful, and also found his nurses to be, he called his nurses angels, and he wanted his legacy to be something that would help address self-care for nurses and care for patients. And so she convened a conference of integrative care providers in New York City that included people with expertise in all of those domains. And then, so the yoga gurus are Rodney Yee and Colleen Seidman Yee. I can't remember all of the people who are the particular leaders in all the different fields, but they came together and figured out, well, how can we blend these therapies, and particularly to address each of the different symptoms in the panic model, so that, for someone who had nausea, for example, you might have them side lying with a restorative yoga. You might not have them moving too much. You'd have their eyes on a single point. But then you'd use peppermint or ginger as their aromatherapy. You do Reiki, and you could do as you did their body scan, you might have some of your talk go through digestion in a positive sort of downward movement. So it's a really interesting training model, and people who come to it, we did the advanced training, or the accelerated training, which was open to people who are already either yoga teachers, which Dianne and I are, or healthcare providers, or Reiki masters, which Dianne and Lori are. But they offer the trainings to people who are lay people, and it's spreading into different hospitals as well. In Colorado, there's a Yoga on High program that's been very successful, and then in UCLA, they have it throughout their hospital. Anyone who wants an integrative urban Zen treatment can ask for it in any division, and they can get it.
I'd like to add, too, is that they have a contemplative component, how to listen, and I really found that to be really life-changing. Not coming up with solutions, but really deeply listening. And it changed the way I am.
Great. Peter, you have one? Yeah.
Very quickly?
Yeah.
Thank you. So touching and so promising to hear about the therapies that are available. I'm wondering how much of the information, or even just the presence of absence of different treatments, wind up in the medical record. And I think of this as sort of the bridging of clinical and research. If someday we have a fellow that might be able to just look retrospectively at a series of cases that were treated versus those that weren't, just to get a little bit more of that evidence and that bridging.
For acupuncture service, we actually dictate all the clinical note. We do no difference compared to any other clinicians. And yeah.
And Reiki and...
Yeah, Reiki and yoga are in the integrative therapy consult form, and we put a note in when we see a patient. For parents, they don't have a medical record, so we don't, but for the kids, we do.
So I just want to chime in a little bit. So we have guidelines for Reiki and aromatherapy at Children's, and we all do our best to, note in the medical chart under integrative therapy, note for nursing.
And it includes how much time. You can add whatever you need to add. If you added a component of guided imagery or visualization or anything like that, you can add that in. So there is a piece in the nursing notes that we can put in there.
Okay, so we are right at time. So again, once again, I wanted to thank our presenters for a fantastic presentation.